Hi, my name is Jessica, and the alternative form of communication that I'm going to be discussing today is sign language. Sign language is a manual form of communication, so it's a little bit different from other alternative forms of communication. You don't require any other books, such as you would in picture exchange communication systems, or any devices, such as you would with speech-generated devices. So it is all just using the learner and their hands to communicate with others. Best population to use for sign language is pretty wide. We hear a lot of individuals using it who have hearing loss, but we can also apply it to those who have autism spectrum disorders. It should be considered, though, however, that despite some success with individuals who have autism spectrum disorder using sign language, there are not a whole ton of single study research designs, so single subject, but we do have a lot more case studies. So we are always looking for that replication in order to make sure that this is an established intervention for those. Jennifer Gaines touches on individuals with autism spectrum disorder being able to only learn a few signs and the duration of that treatment being very, very long in terms of them learning the skills and actually being able to apply it and be fluent in their application of that. So that should be considered when working with individuals who have ASD and potentially determining if sign language is the best intervention for them. Pros of sign language, however, we can see an increase in socialization. Obviously, we are communicating, learning a functional form of communication, and essentially then, in correspondence with that, we can also see a decrease in any maladaptive behaviors that we are seeing because we now have a functional form of communication. Another point to consider with sign language and determining if it is best practice for an individual, we want to make sure that the others who the individual is communicating with also understand sign language. Sign language, though a lot of people have heard of it, it's a pretty well-known communication form, but that does not necessarily mean that everybody is going to be able to understand and interpret sign language. We want to make sure that the individuals interacting with the learner understand sign language and know sign language. Again, sign language can be as basic as one word. For example, we can use the word potty, we can use eat, more, give me, and then we can go all the way up to working in full sentences, as I did in my introduction, so that would be more advanced learners. So again, it can start off being super simple. Again, there is no vocalization used in that. It's not necessary. However, you can say exactly what you're saying, meaning, especially with those who have hearing loss, reading lips is common. So you could say potty and they couldn't actually see your lips moving or just looking at the sign. Another point to consider when looking at sign language is the learner has to have the fine motor ability to make the signs. So as you can see, it's a lot of pinching movements, this would be the letter G, this is the letter I, so a lot of fine motor. If they are lacking that ability or don't have that yet and still need a functional form of communication, sign language might not be the best form as of yet until they can achieve or master those fine motor skills. But sign language definitely should be considered. Looking at all of those previously listed fine motor abilities, making sure others are able to communicate and interpret the sign language as well, and just considering the overall ability of the individual learner to actually learn sign language and implement it. But sign language is an alternative form of communication, and it can be used in place of verbal behavior.